Hello there. We are group healers and today we will be presenting our presentation on first aid. So, what is first aid? First aid is the assistance given to any person suffering a sudden illness or injury, with care provided to preserve life, or to prevent the condition from worsening. So is it necessary for us all to know about first aid? Absolutely. Yes. Everyone should learn at least some basic first aid techniques. As you never know when you might need them. You could be at home, or at work, or at school, or on holiday. Whether it's a minor situation or something more serious, first aid knowledge will give you the confidence to act. You could be the difference between life and death. Our selected topic is first aid for burns. Fire is an essential tool for human beings, but it can be dangerous, or fatal, if not handled properly. Well, let us start off by learning the different types of burns. Burns are divided and classified as first-degree burns, second-degree burns, third-degree burns, and fourth-degree burns. Let us know some more about the different types of burn, which will be further explained by my assistant Jennifer.
Burns are skin injuries caused by heat, chemicals, electricity, or radiation. Your doctor will recommend treatment based on the size of your burn and the layers of skin the burn affects. Your skin has three main layers: the epidermis, the dermis, and the hypodermis or subcutaneous layer containing fat, blood vessels, and nerves. Beneath the skin are tissues such as muscle, fascia, and bone. First-degree or superficial burns affect only your epidermis. The burn site appears red and dry with no blisters and is mildly painful. Second-degree or partial thickness burns involve your epidermis and portions of your upper dermis and lower dermis. The burn site is red and moist and may be blistered, swollen, and very painful. Third-degree or full-thickness burns extend through your dermis and into the hypodermis. The burn site appears patchy in color, ranging from white to brown, with a dry, leathery texture. Because the burn is so deep, it causes little or no pain. Fourth-degree burns involve the destruction of all layers of your skin, sometimes extending into the underlying muscle or bone. These burns are brown, dry, charred, and almost always painless.
Now, let us learn about the treatment with demonstration. For first-degree burns, which affects the top layer of skin. Step 1. Cool the burn. Hold burned skin under cool running water, or immerse in cool water until pain subsides. Step 2. Protect the burn. Cover the burned area with sterile, non-adhesive bandage or with clean cloth. Or cover with a clean plastic cover. Do not apply butter or ointments, which can cause infection. Step 3. Treat pain. Give over-the-counter pain reliever such as ibuprofen or any substitute. Step 4. See a doctor. For second-degree burns, which affects the top two layers of skin. Step 1. Cool the burn. Immerse in cool water for 10 or 15 minutes. Use compresses if running water isn't available. Don't apply ice. Don't break blisters or apply butter or ointments, which can cause infection. Step 2. Protect burn. Cover loosely with sterile, non-stick bandage and secure in place with tape. If the burn is severe, lay the person flat on the ground. Step 3. See a doctor for third-degree burns. Step 1. Call 108 or any emergency number. Step 2. Protect burn area. Cover loosely with sterile, non-stick bandage. Separate burned toes and fingers with dry, sterile dressings. Do not soak burn in water or apply ointments or butter, which can cause infection. Step 3. Prevent shock. Lay the person flat on the ground and elevate the feet about 12 inches and elevate burn area above heart level, if possible. Cover the burned area with a breathable cloth. Check pulse and breathing to monitor the person until emergency help arrives. Step 4. Take the victim carefully to the hospital. If you see someone on fire, immediately get a blanket, thick coat or any cloth, and roll the person on the ground till fire extinguishes. Note, if somebody has no basic knowledge about first aid, then they should call for help and should not treat as they assume. Well, there you go. Now you know a lot more about first aid, especially about first aid for burns. Thank you, and we hope our presentation was worth your while. Presentation by 10th standard students.